Hi everyone, my name is Sydney and I will be demonstrating a PICC line dressing change to teach to the class. My objective for this project that I chose was to display proper supplies needed for a safe PICC line dressing change using aseptic technique and to demonstrate the dressing change. So I would first start off with the class by asking if anyone has had any experience doing this before, or if they've seen shadowed it being done to kind of gauge where the learners are. After that, I have developed a PowerPoint presentation in which I would show them that will be attached to this video um, under the project submission. And I also would give them a reference sheet to send back with them. A lot of times, newer nurses have binders with a lot of good information. So I just made kind of a short one page, which will also be attached, just reviewing the basics over what I reviewed in the PowerPoint. Some of the stuff on this reference sheet goes over safety, which would be identifying the patient, identifying any allergies, to review the order in the computer for the dressing change, providing the patient with a mask, and then to wash your hands prior to starting the dressing change and also before you put the new dressing on. Another section goes over comfort. This just talks about using a pillow to splint the patient's arm and to ensure that the student or nurse has good access to the PICC site for the dressing change. Also, to explain the task to the patient and keep them updated throughout the procedure so they can be aware what's going on. Materials that will be needed is a PICC line dressing kit. This will most likely include sterile gloves, Tegaderm or other type of dressing for the PICC line, the chlorhexidine swabs, new caps, a new IV connector, and additional alcohol pads, a few masks for the patient and the nurse, and then a stat lock. It's important to note that most dressing kits don't actually contain all of these items, so it might take the student a little bit of time to figure out what else is needed from the supply room that they might need. And also a pillow to splint the arm. For the access site, it is important to note that the student should be assessing the site, looking for any types of signs of infection, including inflammation, redness, swelling, drainage, or extreme pain. And if these are present, it's important to get a good assessment when this first started, how long it's been going on, and report this to the doctor, or if this is in an inpatient setting, also report it to the IV team to come take a look at it. For line maintenance, I reviewed to make sure we scrub the hub for at least 30 seconds. Avoid soaking or bathing with the PICC line, always keep it dry. Change the needleless IV hub connectors after blood draws if there's any debris present in the container, or at a minimum of 96 hours with the tubing change if it's in the inpatient setting. Additionally, the dressing change should be done once a week or as needed if it is saturated or falling off. So after the PowerPoint presentation, which would go over everything I went over with the handout, I would give that to the students. And then we will get started. As the educator, I would first do the dressing change and demonstrate. Ideally, this would be done in a like a clinical lab for the patients with a mannequin arm. That way, their first time doing it and demonstrating it won't be done on a real human. Sometimes that is the case, though, with assisted. So we'll get started with the dressing change. Okay, so I would first go to the patient and introduce myself and let them know that I'm going to be doing their dressing change. First starting, I would go and wash my hands, and then I would offer the patient a mask and then also put a mask on for myself. With it being COVID right now, we would most likely already have masks on, but you can always offer a new mask for them. Okay, so obviously I have here the old PICC line. This is not a mannequin arm. I could not get one for the video, but I did have one made up and we'll go ahead and do the dressing change. So I have the pillow behind here that I would splint the arm up on just to have full access to the site. I would start by asking the patient their name and birthday, looking at the computer to review orders, and also if they have any allergies present that we need to be aware of. Occasionally, there might be patients that are allergic to chlorhexidine, in which case we would have to talk to the physician and maybe use alcohol instead of the chlorhexidine for a cleansing. So we'll start by removing the dressing first. This is a clean procedure. I prefer to just get an extra set of sterile gloves to use that, but it is a clean procedure. So I will start, again, wash my hands first, and then I will apply gloves. Okay, so I'm going to get started. I would let the patient know that I'm going to take off their old bandage and to please keep their arm as straight as they can for me without moving it. And ideally, it is best to pull towards the site so we don't risk pulling it out at all. Okay, so this is removed first, and then we have to remove the stat lock, which is preferred to be removed with an alcohol pad. So that is removed. And then I would take off my gloves. And then it is good to use a piece of tape to stabilize the line while we are cleaning around it. Okay, so at this time it's really important the patient isn't moving around. They need to stay still as possible. That way we can ensure that we're not inviting any kind of infection into the area. So I will go ahead and I would wash my hands again at this time before doing the new dressing. And I'm going to apply a set of sterile gloves. And then this is my sterile kit over here. I would place this under the patient's arm because this is sterile. And then the chlorhexidine, I would go ahead and break open, and we can start cleaning around the site. We would clean in an up and down way, and then we would also clean side to side. This can usually be done for about 30 seconds, and I also like to grab a second one. That way we can go ahead and clean really good underneath the site and at the purple hub. So again, that would be about 30 seconds. A lot of kits come with a skin adhesive. This one did not, but after this would dry, we would go ahead and put that on, and we would let that dry as well prior to putting the new dressing on. This kit also came with a bio patch, which helps to just ensure that there is the chlorhexidine at the site for infection risk. So we would put that on. And then at this time, we would put the new stat lock on. So this would rip off, and then the purple PICC line would clamp into it. And for the purposes of this video, it's just going to go underneath. And then after that is on, we will put the new dressing on the patient. And again, this is all a sterile procedure. And then for any kind of blood draws or when we change the dressing, we do prefer to use a new cap and flush the line to make sure that it's working well. It's important to scrub the hub when we change them for at least 30 seconds.